Hell yeah. Hell yeah. So let's, again, I appreciate you giving me so much time for this today. I have two last questions for you.
Sure.
The first one is, if there's students that are watching this, and students being kind of behavioral health provider potential students, or early career professionals, or people that are later in the career but they're thinking about making a change to integrated care, what advice would you give them, and what would you suggest for them to do?
Well, when you asked that, the first thing that came to mind to me was the first thing that I did when I had the mental health collaborative care, integrated care internship at the university for 15 years. And that was have those folks follow primary care clinicians in their day-to-day practice, so that they could really see firsthand what these primary care providers were dealing with, so that they could appreciate the intricate interweaving and interconnectedness of the psychological, the social, and the biomedical health issues that are presenting in every single day, every single hour in primary care, that they can see the challenges that the primary care providers have, and that will, I think, give them a sense of what the patients need, but also how to best help the primary care clinicians. So, as a integrated behavioral health provider, we have multiple customers. We have patients that we're caring for, but we have our clinicians and the team who we are there to help in a way that enhance their function. So, observing folks for quite a while helps you develop relationships with them. It helps you empathize with them. It helps you think about what you can do. It helps you think about what you can do to help patients and the clinicians. So that would be, I think, one thing. And I think it's also important to recognize that every member of the team has their own sense of impotence, and to value your impotence in some ways, as a famous therapist used to say, psychiatrist, value your impotence in some ways as your most valuable possession. Don't go in there feeling like you have to be the person who has the answer to everything, and appreciate that the inadequacy that you feel is in its own way shared by other members of the team, and the fact that you guys can combine forces will help you guys figure out what those fears are and help one another address it and be more effective in meeting the needs of your patients.
Beautiful. Yeah, I like that second one. That's awesome. And what's I don't think it makes sense to me. The first thing that you were talking about shadowing and stuff, that's exactly what Jeff Ryder said on the PCBH Corner when he was video. He said shadow, and I think it's a big thing that we don't talk a lot about for new providers and new students. And one of the things that you highlighted or you just said that really stuck with me is you develop an understanding of what the day is like for a primary care provider. So instead of it being like, oh, I don't know why people aren't getting me. Oh, I don't know why they're not giving me patients or handoffs. Having an understanding of what they do every day, you're like, oh, it doesn't make sense for them to be the one to initiate. I need to be very proactive about this because of all the things that they have to do in their day. It really does give you that sense. I think it humbles you in a lot of ways. It's like, all right, I see what they're doing, and I know now how I can help out in a better or more effective way. That's cool.
I think so, and I think that watching a primary care clinician work allows you as a new incoming behavioral health provider to empathize with their experience. And if they feel your empathy and they feel your respect, they're more likely to trust you and share their patients with you.
They'll uptake it more. That's right. They'll uptake it more because they know you're with them. They know that's interesting.
Yeah, it's a big deal.
Now,